Good afternoon. My name is Richard Gotfried, and I'm the MLA for Calgary-Fish Creek. I'm here today with Salimah Walji-Shivji, Board Chair, Alberta Continuing Care Association, Wendy King, Board Member of the Christian Health Association of Alberta, and Raymond Swonek, Past President, Alberta Seniors and Community Housing Association. I am privileged and honoured that Health Minister Tyler Shandro has asked me to take the lead on tabling of Bill 70, the COVID-19 Related Measures Act. I am grateful for the fact that I am uniquely positioned to champion this bill, given the opportunities I've had to work with the continuing care sector and senior serving community over the past 5 years, and even more closely since just prior to the onset of the COVID-19 pandemic. Bill 70, if passed, would provide clarity and guidance around COVID-19 civil liability protection for Alberta's health sector during these challenging times. The pandemic has clearly put an unprecedented strain on our entire healthcare system, while the sector diligently and compassionately serves thousands of Albertans every day. Alberta, as in other jurisdictions in Canada and around the world, continues to grapple with the unforeseen impacts of COVID-19. These include addressing the gaps in current legislation. Civil liability protection specific to COVID-19 does not currently exist in any legislation in Alberta. While general provisions for liability protection do exist in the Public Health Act, the legislation does not specifically address the unique context in the event of transmission or potential transmission of COVID-19. If passed, the proposed legislation would apply to Alberta Health Services and those contracted by AHS to provide publicly funded healthcare services such as home care, regulated health professionals, health service facilities such as hospitals, long-term care, lodges, licensed supportive living, pharmacies, and residential addiction treatment facilities, and any owner, employee, contractor, and others in these above groups. I'd remind everyone that many of the operators and employee groups referenced here represent community-based organizations with limited means and include not-for-profits, faith-based, and independent private sector operators alike. As a starting point, the government is focusing on the health sector, where the impacts of exposure and transmission of COVID-19 are potentially greatest. This legislation would also include the ability to introduce regulations to expand the scope of coverage, if indicated, to other sectors and to workers in other settings as deemed appropriate in the future. Since the beginning of the pandemic, the health and senior serving sectors have navigated this difficult situation to deliver vital services while protecting Albertans every single day. This includes many continuing care facilities across the province. Maintaining the health and safety of our most vulnerable citizens has and will continue to be a priority for Alberta's government. Families, clients, and residents across the province continue to rely on continuing care operators and workers to conscientiously support their health and broader quality of life priorities. Important work in service of some of our most cherished citizens, and arguably those that contributed so much in helping to build this great province. Our government has and will continue in its commitment to doing everything possible to protect vulnerable Albertans and workers from COVID-19 and its effects. This includes broad funding for increased staffing, additional cleaning supplies, and personal protective equipment, and prioritized rollout of COVID-19 vaccine to staff, residents, and other care and service providers. And yet, even when public health orders and guidelines are rigorously executed and with the highest adherence to duty and standards of care, there is always a risk that the virus may surface almost anywhere, including healthcare settings. And hence, you can clearly appreciate the primary impetus behind this insightful and well-balanced legislation. COVID-19 civil liability protection is needed for those who act in good faith to follow public health guidance and legislation, and support and protect Albertans during the COVID-19 pandemic. The proposed legislation would provide the health sector with protection from civil legal action associated with an individual being or potentially being infected with or exposed to COVID-19. The protection would, however, not, and I repeat not, extend to those deemed grossly negligent. Other jurisdictions such as British Columbia, New Brunswick, Nova Scotia, and Ontario have already enacted COVID-19 liability protection, and Saskatchewan is in the process of passing similar legislation. BC's approach identifies scope through regulations, similar to what Alberta is proposing, though we are launching ours with a clear focus on the health sector. If the legislation passes, the government will continually monitor the impact of this legislation. The proposed legislation is flexible and allows for introduction of additional regulations to extend COVID-19 civil liability protection to other sectors if and as required. If the Act is passed, and we hope it will be, it would be retroactive to March 1st, 2020, just a few days prior to Alberta's first announced case on March 5th of last year. Thank you, and I would now like to invite Wendy King, Board Member, Christian Health Association of Alberta, to say a few words. Then we'll hear from Salimah Walji-Shivji, Board Chair of the Alberta Continuing Care Association. And finally, if I can get to my next page here, followed by Raymond Swonek, past President of the Alberta Seniors and Community Housing Association. Thank you.
Thank you, MLA Gotfried. The Christian Health Association of Alberta represents Alberta's not-for-profit, faith-based providers of continuing care services and operates in nearly half of Alberta's municipalities, offering more than 14,000 spaces for seniors and adults with disabilities. We are committed to providing the highest quality care and support with integrity, empathy, and respect to those most vulnerable and least able to advocate for themselves. Our operators have been working diligently to keep seniors and staff safe from COVID-19 by following all public health orders issued, including best practice outbreak protocols. As operators, we are very appreciative of the expert guidance we have received from the Chief Medical Officer, Alberta Health, and Alberta Health Services throughout the pandemic. We're also very appreciative of the transparency and frequency of communications that we have had with our residents and families as we all worked together to minimize the risks to those in our care, particularly in sites that experienced outbreaks. Our hearts and prayers are with those who have suffered from this insidious disease and for those who have lost loved ones. We have learned much about COVID-19 and pandemic management throughout the past year, and we will continue to learn more as our vaccine rollout continues. The proposed civil liability protection legislation ensures all service providers, whether AHS or contracted providers like CHAA members, have the protection that they need to continue to provide the excellent care and services to seniors. This legislation reaffirms the accountability that is placed on every operator to diligently follow all public health orders, and it also offers protection for operators that continue to meet this essential standard of care and due diligence. We thank you for allowing us to be of service in the development of this critical legislation. Thank you, and I will now turn it over to Salimah. Thank you.
Thank you. Good afternoon. My name is Salimah Walji-Shivji. I'm honored to serve as the board chair for the Continuing Care Association. On behalf of the ACCA, I would like to thank Premier Kenney, Minister Shandro, Minister Madhu, and MLA Gotfried for including the ACCA in today's announcement. The ACCA represents nonprofit, faith-based, and private operators providing care and services for seniors and persons with disabilities across the continuum of care, including home care, supported living, and long-term care. Our members operate more than half of the designated supported living and long-term care beds in Alberta. We would like to thank the government for their collaboration and support in responding to the many challenges faced by the continuing care sector over the last year, and specifically the collaboration over the past months on this very important piece of legislation. Throughout the COVID-19 pandemic, continuing care operators and staff have worked tirelessly, prioritizing the safety and well-being of our residents and clients. We have advocated throughout the pandemic for adaptations that enhance the safety of care homes, including advocating for single site, access to PPE, vaccine rollout, and collaborating on medical officer of health orders. The ACCA is thankful for the collaborative relationship we have with Alberta Health and Alberta Health Services. Thank you again to Premier Kenney, Minister Chandro, Minister Madhu, and MLA Gotfried for the announcement and the proposed COVID-19 Related Measures Act. Thank you. I will now turn it over to Raymond.
Thank you, Salimah. We are pleased that the Government of Alberta is proposing this legislation. Our housing providers, along with their frontline employees, have worked tirelessly to keep seniors safe, healthy, and happy in our residential settings. Our communities provide a family atmosphere that allows residents to have the socialization, services, and essential visits that they need within the parameters of the health restrictions and regulations. Protection from liability for licensed supported living providers who are compliant with all the government regulations and orders from the Chief Medical Officer of Health is a huge relief. Knowing that balancing compliance with the orders and supporting quality of life for the residents will not place our operators in any legal uncertainty. This is a big relief for our member communities. Insurance coverage for all senior housing types does not include coverage for infectious diseases. Any operator working in full compliance with the orders has been open and very vulnerable. This protection is vital to support over 100 member organizations, their thousands of employees, and over 40,000 Albertans that they have supported to be kept safe in this last year. Thank you to the Government of Alberta for working with the Alberta Seniors and Community Housing Association and our members to keep vulnerable Albertans healthy, safe, and happy during this unprecedented time. Thank you.
All right, thanks. That completes the presentation, so we'll open it for questions now. A reminder, I know reporters are all aware we're under embargo until the bill's introduced. We have a number of speakers plus senior staff from Alberta Health from the tech briefing available to answer questions, so if we need to switch around, just give us a moment. We'll ask reporters to limit yourselves to one question and one follow-up. So with that, we'll take the first call, please.
Our first question comes from Audrey Nouveau, Radio Canada.
Hi, thank you for taking my question. It is for Mr. Gotfried. You say that Alberta's legislation is modeled after BC's and Ontario's, but BC's doesn't cover long-term care facilities, continuing care, and Ontario does. But over there, it's been heavily criticized for letting the negligent ones get away. So why are you covering the long-term care facilities?
Audrey, thank you for your question. As specified in the bill, we're focusing on the health sector in Alberta, but as clearly pointed out, there is no protection against gross negligence. And so the ability to sue for gross negligence is not removed, so that the facilities that you've mentioned there will be held accountable for any breaches of that as adjudicated by the court. So we are ensuring that there's protection for those that have diligently followed the standards of care, the normal standards of care, but also those enhanced measures brought forward by COVID-19, and those that have done so will be protected insofar as there is not gross negligence.
Thanks, Audrey. Follow-up?
Yes, there's quite a large range of things that can happen between acting in good faith and gross negligence. So isn't that putting the bar very high, even too high?
Well, thanks again, Audrey. The determination of that bar, I think, is up to the courts. There's the term gross negligence is a well-established standard within the judicial system. It'd be inappropriate for me to comment on what that measure is, but we are not, again, not taking away any opportunity if there's anybody who has not acted in the greatest of compliance and in good faith with respect to meeting those standards of care and the public health measures that are in place, then they will be subject to the full force of the law.
Okay, thanks. We'll go to the next call.
Chris Epp, CTV.
Thank you, Minister. I guess just following that, isn't there a danger that you're potentially just absolving these facilities from anything that could go wrong? It feels like it's really going to force people who believe they have a legitimate case to really push the ball uphill here, given that it's being legislated that, that the threshold is so high to prove.
Thank you, Chris. Just a correction, I'm not a minister, I'm just the MLA for Calgary-Fish Creek. But on your question there again, the thresholds are in place. The concept of gross negligence is a well-established one within the judicial system. So the raising the standards of that, I think really is just to recognize that we have put in place incredibly high standards through this pandemic and in regular times as well, during the regular standards of care. But during the pandemic, the Chief Medical Officer and Alberta Health Services have instituted incredibly high standards of care, changing regulations over the period of time with strict adherence to that. Many audits from various sources to protect residents, to protect staff, and to protect visitors to those facilities. So again, the standards that they're meeting, if they're meeting those standards, that's where this protection is meant to guide people in terms of any incidents or situations that they feel. I personally have 3 family members in continuing care or licensed supportive living, and I think everyone deserves to have that opportunity if the level of negligence is measured up to that gross negligence that has been stated in this legislation.
Thanks for that. Chris, follow?
Yeah, I'd actually be interested to hear from any of the providers or in that industry just how much of a chill goes through the industry when you do see lawsuits or when there are death counts. Like, how much of it is that sort of a dark cloud over you as you try to function all the time?
That's a good question, Chris. You know, I was lucky enough to have about a 5-year relationship with the sector, but that including the associations, the representatives, the clients, the residents of the facilities. I can tell you the level of dedication, compassion, and concern for the well-being of the residents is universal across the sector. I've been on calls almost weekly with the sector since the beginning of this pandemic. I am really incredibly impressed by that high level of compassion, the standards that are being met, and what's keeping those operators awake at night is not about lawsuits, it's about care, and it's about protection, and it's about health and safety of their residents, and they've gone to Herculean efforts to achieve that. So I think that I'm very proud of our operators across all sectors, whether that's the private, the faith-based, or the not-for-profit sector. All have been operating at incredibly high standards during a very, very difficult time for all Albertans, and I'm extremely proud of the work that they've done.
Okay. Thanks for that. We'll go to the next question, please.
Michelle Belfontaine, CBC.
Hi there. This is a question for Richard Gotfried. I mean, you were talking about not-for-profit operators, but there are also for-profit operators in this sector. And people have criticized your government for always taking the side of corporate interests. So what do you say to people that will say when it comes to supporting families who lost loved ones in long-term care homes due to COVID versus supporting private operators, your government is taking the side of private operators and shielding them from accountability with this bill?
Thanks, Michelle. I don't believe that's the case at all. In fact, the operators across this province, again, are not-for-profit, faith-based, and private sector operators, which, in fact, is one of the strengths of our system here in Alberta, that we have operators across those, all meeting the same high standards. So I can appreciate where you're coming from with that. However, I believe that the legislation does not protect anybody from gross negligence. So if gross negligence is suspected, and if somebody wishes to launch a lawsuit which includes that gross negligence as part of the action, then absolutely everyone should be held to account, irrespective of which sector they come from.
Thanks, Michelle. We'll go to your follow in a second. Sorry, just hang on a sec. It sounded like there was some interference or maybe someone not muted on the line. Michelle, did you get that answer clearly?
Yes, I did. It was me trying to jump in. Richard, I'm sorry, but you're sounding like an apologist here for the industry, and I have to jump in here and say that there are for-profit operators in this industry, like Bravera and other large companies. So again, what do you say to families that think that your government is taking the side of private for-profit operators in this sector with this legislation?
Michelle, again, This legislation does not remove anyone's ability to launch a lawsuit if they feel that there is gross negligence. So, in fact, again, the operators represent a broad spectrum here. We have lodges, we have individuals, we have the staff members, we have so many across all the sectors. This is not meant to protect anyone. It is actually meant to hold people to account. But they're also being held to account by meeting the high standards of care and by the process that Alberta Health Services and the Chief Medical Officer has to ensure that those high standards are being met. If somebody is not meeting those high standards and there is a death or illness amongst one of the residents and a family member feels that or the individual feels that meets the standards of gross negligence, I absolutely encourage them, as I would personally with any of my relatives, if that were the case, I encourage them to pursue that to the full force of the law.
Thanks, Michelle. We'll go to the next call.
Our next question comes from Catherine Grgowski, Alberta Today.
Well, thanks for taking my question. Another question for Mr. Gotfried. So it does appear that this was done in consultation with the continuing care sector and other healthcare providers. And I'm wondering, what, if any, consultation did you do with patient advocates or family advocates for this bill?
Thank you for that question. There was a lot of back and forth with all operators, but also, as you know, that there are the family councils that are part of that as well. So we've had consultation. I can tell you, I'm on calls with seniors, residents, and family members almost every day myself, and I know that all of our MLAs and the ministry is as well. So this was not something we rushed into. We looked at what was happening in other provinces. You've seen the comparators with BC and Ontario and some of the Atlantic provinces as well. The concern we have is the viability of the sector, broad brush, private sector, not-for-profit, faith-based operators as well, that we can continue to have them focus on the health and well-being as we go through past 1 year of this pandemic. So we want them focused on the care and safety and health of the residents at the same time. So we've listened to many. We've been cautious with the launching of this to ensure that we've done our due diligence. But there's no question, as was mentioned by some of our operators here today, that they're facing challenges because they're increasing insurance costs, which then are going to move on to increased costs of care for our seniors across Alberta. So we've looked at that. We've looked at a balance. But again, I want to reiterate here, we have not removed people's ability to pursue a lawsuit if there is gross negligence in place. So we're not removing that. We are just ensuring the viability and sustainability of the sector during a very difficult time for Alberta.
Follow, Catherine?
Yeah, it's more of a procedural question, but as Audrey mentioned, this type of legislation has been very contentious in Ontario, and I'm wondering why this is coming from you as a private member rather than a minister.
Well, in fact, Catherine, I'm very honored and privileged to be able to do this. As I mentioned earlier, I've been working with the sector and with residents and with senior serving associations across this province for 5 years, actually 6 years now since I was elected, even as an opposition member, but now as a private member of the UCP caucus. And this is an opportunity for me, through the relationships that I've established, to working with the sector, working with residents, working with challenges within the community. So I'm just very honored and privileged to have this, that the minister would consider me to bring this forward. It's not without precedent. It happens across many legislatures across the country. So I'm happy to be involved with it. I happen to be fairly conversant with much of it, although there are many more experts than me. But I just feel very privileged and honored to do so. And I'll be defending, obviously, this bill and hoping that our legislative colleagues from all sides of the aisle will support this. But we expect their tough questions as we go forward.
Thanks for that. I think we have just one more caller on the line, so we'll go to the last call. Thanks.
Janet French, CBC.
Hi there. Thanks for taking my question. First one is for Richard. When you consulted with these family councils that you refer to and these seniors, did you float this intent of legislation before them? And what was their reaction? What did they say when they heard about your idea or your hopes?
This was just from my own anecdotal engagement with many residents. I am in very constant contact with those in my own constituency, and as I mentioned, I have 3 family members in different levels of continuing care. But also, I'm chairing the continuing care review at this point in time as well, which gives me an opportunity. In that group, we have representatives from First Nations, we have representatives from former staff groups, we have representatives from current residents, we have representatives from family members of current residents. So we've had a lot of feedback on that side, which I've been able to sort of bring to the lens on this. But quite frankly, we've consulted broadly. Again, we've been looking at this. I think if we look back to the other provinces, many of those enacted them during 2020. So we have not rushed into this. We've watched closely what they've done. As you can see, we've limited this to the health sector at this point in time. But with the regulation, we can expand that to other sectors if and as appropriate going forward. So the consultation that we've done with this has been broad spectrum, not just with the operators and the associations, which I have the greatest respect for, but also reaching out with respect to the impact on residents. But again, I'll reiterate here again, we're not removing any ability for people to pursue lawsuits if they feel that gross negligence has occurred. We are ensuring that the level of negligence has to be measured against the standards and the adherence to the high standards of care that are put in place on a day-to-day basis, but also those layered upon it by the Chief Medical Officer in Alberta Health Services during this pandemic.
So I said we would end there, but I think we've got one more reporter on the line. Lisa, if you're there, go ahead, and then we'll end with you.
Lisa Johnson, Edmonton Journal.
Thanks, Steve. This question is also for Mr. Gotfried. You mentioned that this won't prevent lawsuits and would still allow them, but would you acknowledge that the lawsuits already underway are severely threatened by this legislation? And what would you say to the families who believe that their family members have died due to negligence? What do you say to them? This could threaten their lawsuits.
Well, first, foremost, I think our thoughts and prayers go out to anyone who's lost a family member during this. But those lawsuits are open for them to just refile and to include the gross negligence. So I'm going to make an assumption here that those family members feel, or those residents feel, that there was gross negligence to take it forward for a lawsuit, and it is a simple filing, I believe, with the courts. I'm not a lawyer, nor am I a legal expert, but it just means that they have to refile those and reference gross negligence as part of the suit.
Thanks. So, Lisa, one quick follow, and then we'll wrap up.
Thanks, Steve. So, essentially, if AHS is protected by this legislation, including Dr. Deanie Hinshaw, and if, hypothetically, all operators make an honest effort in good faith, who then is responsible for the hundreds of people who have died because of COVID-19 and who have died, arguably, because of somebody else's negligence? Who's responsible? Lawmakers? You?
Lisa, thanks for that question. I think my answer there is, again, I think the courts will determine that. If the measure and I guess the burden of proof of gross negligence is proven in courts, then those people will be held accountable. And we absolutely will not protect any bad apples for gross negligence in the performance of their duty. If they're acting in good faith, if they've met the standards of care and the public health measures that have been in place, that gives them some level of protection, perhaps, and proof that needs to be proven. But that's up to the courts. So gross negligence will be, if there is a case in front of the courts, I believe the judicial system will handle that, and will handle that in a fair and balanced manner to the benefit of residents and to the operators at that time.
Thanks very much. We'll wrap it up there. Reminder, we're under embargo until the bill is introduced. Thanks, MLA Gotfried, all our guests, and reporters who called in.